Right.
Now, I always think it's nice to kind of go on the outside, then we're going to work our way in. So we kind of orientate ourselves. We have the sigmoid colon coming down into the straight, which is going to be the rectus, or the rectum, and emptying out into the anus. Now what's more, like I just said, for male we have the bladder right here, and emptying into the bladder is going to be our ureters. So from kidney to bladder, you're going to have a tube carrying urine. It has a different name than from bladder to outside world. So from the kidney down, so from kidney to bladder, which let's just imagine is right there, we have ureters. Once it gets to the bladder and it leaves, then it's going to become a, so this is a ureter coming in, but once it leaves the bladder, it's a urethra. So if this is a bladder, coming in we had ureter, leaving we have urethra. Cool?
Is that the same as the penile urethra?
So this whole thing is going to be a urethra, but depending on where we are, we're going to have a different name for it. So the penile urethra is just going to be found inside the penis.
Okay.
Membranous is going to be this kind of midway point, and it's also important. So we have the prostatic urethra. The prostatic urethra is going to be found right in the prostate. Now to kind of illustrate all these different structures a little better, let's kind of jump ahead to the testes and talk about the path that sperm will take to get out of the body, and that'll kind of help us identify a lot of these structures. So, a couple reasons. The reason that male testes are not like female ovaries where they're found inside the body, but rather outside the body, is because that spermatogenesis, the formation of sperm cells, has to happen at a temperature slightly cooler than our body temperature. So we have a couple ways to keep things cool down there. We keep things outside of our body, that's one. Two is that we have this large network of veins. All this blue area is going to be all these veins. So you have pretty much just like a fiber optic network of veins. They're going to bring blood away from the testes to cool things down even more. So once sperm is formed, it's going to travel from the epididymis, which is this structure.
Yeah, I want to know
What's up?
the tunica.
Albuginia. So albuginia, think albino. It's a white covering around the testes.
Right. So is that? Are they marking like testes here? Are they marking the like? What are they marking that?
Well, so the tunica vaginalis
Or here.
is going to be the most intimal layer, and then one layer out is going to be albuginia. So it's actually going to be this kind of gray area.
That gray,
Yeah.
and it's only going to be on that one side.
I think they're actually showing it on both. I think both
I
these
mean-
would be tunica albuginia, but odds are good. Just the first layer out from the testes will be
Right.
albuginia.
Okay.
What's the blue part?
Blue or gray?
Yep.
Yeah, I was kind of confused.
So in the testes, sperm is made. And if you guys wouldn't mind flashing forward or back, there's a page where it shows kind of a cross section of everything.
This one.
Maybe one more.
This one?
That one, exactly. Okay. So we're starting in the testes, and as we move up, we hit the epididymis, which is kind of this starts at the top, kind of goes back structure that wraps around the testes. And in gross anatomy, it's weird. It kind of looks a little bit like ramen. It's this kind of network of like small tubules that are right behind the testes. Now that's going to carry sperm up, over the bladder. Now where do we see that in this model? It's going over the bladder right here.
And that's the ductus?
Yeah, that's the vas deferens. So this is going to be your vas deferens. Or ductus deferens. Either or is fine. But so it comes from the testes, up the spermatocord, out, and then here's the bladder, and it's going to go right over the bladder. And then come back down. So as it's coming down, you encounter two more structures that are going to add fluid to the sperm to make it into semen. 110 is going to be the seminal vesicle, and this is going to be the prostate. Now, why are these important? Why do we even want to add fluid to it? Why would you not just have sperm go straight out through the urethra? Because that's all that you need for fertilization. The reason being is that for sperm to get from testy to egg, you got to pass a pretty tough terrain. We have urine that is passing through here normally, so it's going to be a slightly acidic environment. And same thing in women. The pH of the vagina is quite a bit lower than sperm can survive in. So that's the reason we have turned sperm into semen, is we have to add fluid that's going to be slightly basic, and it's going to be almost like a mucousy covering to allow the sperm not to be killed by the acidic environment that it passes through, both in the penis and in the vagina. Now, those two areas that we're going to add fluid are the seminal vesicle and the prostate. The seminal vesicle and the prostate work to add actually fructose, which is, we're getting into physiology, but it's worth noting. You add fructose to the sperm because the sperm are actually going to be swimming for about 1 to 2 days, and the fructose is a fuel source for them to make it up into the fallopian tube for fertilization. So to recap, testy, epididymis, it's going to travel up, go over the bladder, run into this kind of spongy-like structure called the seminal vesicle, and then this almost balloon structure surrounding the base of the bladder will be the prostate. And then after that, it can travel out through the urethra to fertilize an egg. Questions on that?
Where was the epididymis on?
So the epididymis on the model, remember it's going to start at the top and kind of go back. So here we can see it as this almost eyelid-like structure to the testy. That's your epididymis. Yeah?
Yep.